No, when we say supernatural, anything which is non-algorithmic, people think it must be supernatural.
No, not necessarily. There are a lot of brain processes which we think are not done algorithmically.
Yes.
But exactly how they're done, we don't know.
Yes. So it could be a extraordinary human potential.
It could be, absolutely.
Just, within the human context.
Yeah, yeah. I mean, there are extraordinary aspects of the human mind and human potential that remain unrealized, unstudied, poorly studied. It may turn out when you study them that they fizzle out.
Mm.
You have to be prepared for that possibility.
Yes, yes, yes.
But
that's hard science.
yeah, exactly. But on the other hand, there's a good chance it may not fizzle out and may discover new principles of brain organization.
Now, one other
Especially with the brain, we know so little that you have to be humble.
Mm. I was with Dr. Vasant Lad, who's an eminent Ayurvedic doctor in New Mexico, for some treatment. And he is reviving Nadi Pariksha, which is the pulse, 7 levels of pulse. Mm-hmm. He says that the beats per minute is just 1 level of pulse. There are beats within beats within beats. Mm. And then he says that there are 3 fingers you use, and each finger you can feel a pulse here, 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 here. Different places you feel different pulses. So he is teaching a 2-year course, 30 students taking that course, and he's teaching them.
That's very interesting. So what one could do is to transduce these into. I wonder if you do a Fourier analysis of the waveform, the pulse. There are components which correspond to what he's talking about. And
he says certain pattern is going to diagnose something with your liver. Another pattern is some other organ.
My initial reaction as a physician would be to say that doesn't make any sense. But on the other hand, I have an open mind as a scientist.
But here's what I'm possible. But here's what I'm saying: the empirical fact.
Okay.
30 students are sitting there, and he says, "Okay, now I've taught you this particular technique for liver or whatever, one particular pattern he's explained. So each of you do it on yourself, and there's a form you have to fill out what you measured, and then you do with your neighboring person for each other." Mm-hmm. So they do that. They come one by one to him. He doesn't read what's in the form. He measures that person, and he gives his prediction, his diagnosis, his reading, and the person reads it out. And in 12 out of 30 cases, it was an exact match. Mm. So those 12 students got it right.
This is normal, not even disease.
No, this is like your particular system, what your body types are, what your liver body type is, what your kidney body type is. He's giving you that analysis. Uh-huh. Whether it's diseased or not, he's telling you what the reading is.
Something is not balanced.
So yeah, so what he's saying is that what I found is that 12 out of 30 students were able to get a reading which matched the teacher's reading. So it's not a coincidence that they're just randomly doing it. So they were able to measure this. They were able to detect those patterns.
Now, all I can think of is your liver disease, which is very pronounced. It's going to affect the blood pressure in the portal veins and maybe inferior vena cava, and somehow affecting the pulse in some mysterious way we don't clearly understand. But it's not impossible. What I'm saying is there are pathways. It's affecting the pulse waveform. This is being picked up by the finger. So if it's heart disease, valvular disease versus arterial disease versus liver disease, there may be subtle differences in the pulse form which is being picked up.
But the Western system is not even concerned about measuring the waveform more than just the number of beats.
Yeah.
So first thing is how to read it is a second issue. But first is at least learn how to measure a more complex waveform. Mm-hmm. And that he's doing and able to teach his students. So I think there's a lot of...
so if I were to bring a person with liver disease, cirrhosis of the liver, early cirrhosis or hepatitis, and if I were to bring somebody with coronary heart disease, bring him into the room and then not tell him who's who. So you can just only...
He should be able to tell. He should be able to tell. And he was very exact in diagnosing. It's very interesting, he didn't want any medical data from any of us. He didn't want to fill out a questionnaire like many Ayurvedics to make you fill out a questionnaire and then they diagnose you. He just wanted to feel the pulse, and he told a lot of things to my wife, and he said this is that is that, and it was very accurate.
Wow.
It's pretty interesting. So and he feels that this...
What's his name again?
Dr. Lad, L-A-D.
L-A-D, Lad.
L-A-D. He's one of the most eminent...
What nationality?
Indian guy.
Indian.
He says that this Nadi Pariksha, the pulse Pariksha investigation is sort of a dying art, and he's one of the few guys, he's reviving it and he's teaching students to revive this back.
So it's a different system of medicine then?
No, it is within Ayurveda, subspecialty of
The
pulse diagnosis.
medicines are all same Ayurvedic medicines.
He will prescribe Ayurvedic medicines, but he will diagnose it using the pulse.
Ah.
A very interesting sort of a thing.
Yeah, it's
So it requires quietening his mind, quietening himself to such an extent that he can feel very feeble things which ordinarily people won't be able to feel.
Mm-hmm.
So this is an interesting point. Now I wanted to find out from you, in your work on mirror neurons, which is extraordinary breakthrough that one of your many breakthroughs,